Welcome to SpaMedicaTV. TV. My name is Dr. Stephen Mulholland. Good to see you again. We're going to talk about a very, very popular topic, liposuction, the contouring of unwanted fat. Little convex distensions, lumps and bumps, saddlebags, the pot, the love handles, the inner and outer thighs, the things that we don't like, that we can't get with exercise and diet. Liposuction has totally changed. Gone is that primitive sort of prehistoric technique you've seen on Nip Tuck or Extreme Makeover, where there's a large cannula that traumatically removes the fat. Over the last few years, with the emergence of SmartLipo, body tight, vaser ultrasonic liposuction, we use energy, gentle energy, to liquefy the fat, tighten the skin, and then remove that liquefied fat to get good skin shrinkage and nice contours. Let's take a look.
Because more and more men are opting for plastic surgery, actually, to keep them looking young. So in today's personal story, we follow Albert, a young dad who wanted to change up his looks.
When I'm walking down the street, I feel like people are looking at me. Just this little gall in here that really bothers me whenever I get a glimpse of it. The line on my forehead and the double chin. I know in real life it might not be as bad, but if you take a look at pictures, you can really tell. I'm gonna get rid of it.
Look at you with the fish.
No, put that away.
My dad's gonna be doing a procedure to fix his chin, so he doesn't have the fat sticking out.
I think the day after, you know, taking care of it. The bruising, swelling, things like that. That's, I think, to be expected. Or otherwise, I'm really excited for him, so.
This is an example of how my chin used to be. I'm getting older and I feel that I need a little bit of a change and just to bring my self-esteem a little bit more up. I decided to go see a specialist. He's gonna be doing what's called a SmartLipo. I know I've heard in the past, though, it's only women that are doing these kind of things, but I don't think that's right. A lot of men are going through these procedures today to better themselves, to look better, to look younger, to feel better about themselves. So I don't see anything wrong with it. I'm scared, but I'm not gonna let that stop me. Hello.
How are you?
Good, how are you?
Good.
I'm going to see Dr. Mulholland for 11.
Perfect. If you just want to have a seat, I'll let him know that you're here.
Thank you. I just want it to be over. I'm okay. Just not trying not to think about it.
What we're doing today is very common in men, which is treating a double chin. He's got a lot of lines, worry lines, and he's lost a little bit of his under eye fat, so he's starting to look a little tired. Now I'm going to do a little bit under the skin. We're going to freeze the fat. Almost done here, Albert. You're doing beautifully. So I'm going to be melting and removing the fat and tightening the skin under your chin. I'm using a little tiny fiber optic laser here. You can see the red beam, and that's going to be melting the fat and tightening the skin while we do this. So this is so far a lot easier than you thought it would be.
Yeah.
Now we're going to phase 2, which is removing some of that melted fat. Okay, Albert, you're doing great. We're almost finished. I'm loving the contour here. You told many people about your procedure?
No, only about.
Women are more and more forthright about their cosmetic procedures. With men, still very hush-hush, very taboo. Whatever they've achieved, they achieve through hard work and through their own determination and not through some sort of sissy plastic surgery procedure. I'll put a little bit of filler right here to give you a little less tired look. Relax. I'm going to do a little bit of Botox now, very tiny needle. This Botox gets into the muscle in about 3 hours. Now we're going to do your worry lines at the top of the forehead here. I think you can see already the nice improvement in Albert's neckline. The recovery is pretty quick. There's a little swelling, little bruising. The risks are low, but anytime we use any type of laser light device, there's a risk of irregularity, asymmetry, not having good skin tone and loose skin, or a little burn where there may be excess heat. We are very much a culture of youth and beauty that is particularly focused on women. When I first started over a decade ago, I might see 1 or 2 guys a year. Now, about 20% of my clients are men.
I feel relieved that it's over. So it'll all go with.
You have a boo-boo under here.
Yeah, a little one.
Joining us in studio now is Albert's cosmetic plastic surgeon, Dr. Stephen Mulholland. Thanks for being here.
Thank you very much.
Nice to see you again. How's Albert doing?
He's doing great. His recovery was less than a week, which most guys want to get back to who they are very quickly.
Of course.
Very little pain and discomfort. Guys are very wimpy when it comes to pain and discomfort.
They are more than women?
Oh, Absolutely. I think we're genetically hardwired to, you know, take a woolly mammoth's tusk to the abdomen or a shotgun blast to the leg, but don't give me a little flick or a little needle. That's way too much. Where women are more conditioned culturally and certainly as mothers and of children to hair removal and waxing, and they're just subject to more discomfort to look their best. Guys have not been attuned to that.
We're just tougher. We're just tougher. That's
genetically
just say
tougher.
It's all good. It's all good. Okay, I think we have some before and afters of Albert. Unfortunately, he couldn't be here today. He had a personal emergency.
So he was looking a little droopy, a little angry. He still looked good for his age, but guys very much about a tight jawline. They want to look, you know, good in the boardroom and good in the bedroom. And 3 or 4.
Yes. And there's nothing wrong with that. I like it.
And so 3 or 4 chins generally bothers a guy. They want that Newt Rockney, Clint Eastwood type of jaw.
John Hamm.
Right. And so he just had a little SmartLipo of his jawline to improve his jawline. Nothing severe. Something done under local anesthesia.
Yeah, no, we saw he was totally awake through the whole thing, and you were chatting with him.
And he was a bit angry looking. He looked malevolent. His forehead was dangerous looking, and he's a friendly guy. You know?
Sorry, when you say recovery, back to work when?
Oh, he was back to work within 2-3 days.
Okay.
Yeah.
Okay, so did he have to wear that brace around his head for long?
So a lot of guys do this on a Thursday night or Friday morning, back on a Monday.
Wow.
That's very common. Yeah.
Okay, and is he happy with the results?
I think he's very happy. When I saw him about a month after, he said it's really changed his disposition. He didn't, you know, he's in a job where he has to sell himself, and he's looking angry and sort of dangerous. And so it's given him a stronger jaw, but a more approachable looking brow, because guys often look very frowny and dangerous. And if you're a lawyer or a judge, that's great. But if you're a sales guy, that's not.
No, you want to be Mr. Friendly. Yeah, his kids weren't scared of him, which is nice.
Right.
That's you know, that's good. You said a little bit of bruising, and was he in a lot of pain? Like,
no,
do you have to take painkillers? Like
no,
that?
a lot of people think about lipo and they think they've all seen some episode of Nip Tuck where there's this crazy thing going very aggressively.
Well, you brought the little teeny tiny in, didn't you?
Yeah, this is the would be the SmartLipo probe. It's a little laser filament about 600 microns, and that little filament goes very gently back and forth in the fat, and it melts. Think of a chunk of butter. It melts the butter, and then taking out that melted butter is much simpler.
So you just put a little suction in there and take it all out.
Rather than trying to extract the whole block.
Which is what was done historically, correct?
Historically, liposuction was mechanically breaking up the fat, removing it. Now we do a 2-stage process. We use an energy system like SmartLipo laser to melt it, and then the extraction is really easy. That means almost no pain, bruising, or downtime.
All right, we have lots more to talk about with male plastic cosmetic surgery when we come back. Stay with us. Welcome back to Doctor in the House. You know, it's not just women heading under the knife for the beauty anymore. Cosmetic plastic surgeon Dr. Stephen Mulholland is back with more on what men are looking to change. So when they come into your office, what are the most common things men want to change about themselves?
Yeah, 11 years ago when I started, I saw one guy the entire year. Last year, I did about 130 little facial lift procedures. 30 of them were in men.
Really?
Shows you the huge transition in the practice. What do they come in for? Guys come in because they lose their maleness. So a strong chin. They come in for little neck lifts and SmartLipos like Albert.
Or they come in like a 5-minute nose job. What's that?
Yeah. Okay. So they come in for bags under the eyes or a nose that's starting to fall or it's too droopy.
Like this guy.
Like this gentleman. You know, he doesn't want to do a nose job, but we can through some of the injectable products like Reston or Perlane in 5 minutes, I can give him a stronger nose.
Seriously? That's pretty good.
Yeah, that's a very popular procedure for guys that find when they smile, their tip is touching their upper lip. With age, it starts.
Was he awake for that?
He was awake. That's under local anesthesia.
Local anesthesia.
Everything you're going to see today, in fact, can be done under local anesthesia.
Okay, what about eyelids?
Eyelids very common. You look droopy, you look tired, and he just looks alive, a little more awake, and a very simple thing to do, upper and lower lids for guys.
I never knew that lids was also lower. I always thought it was just up there.
Very common. Guys will come with bags, and they're supposed to look alert and active in the boardroom, but they look tired even if they've had a great sleep. Lower lid bags, very common.
The Perlane and the Restylane, permanent? Not permanent.
I don't like to do permanents because the face changes, especially a guy's nose. So an injectable like Reston or Perlane for a 5-minute nose job will last about a year. So guys come in once a year and get touched up.
What about neck lift is the next one?
Neck lift is very common. Again, if it's loose skin and not fat like Albert, a little pull on the loose skin gives you that tight Clint Eastwood, I'm an aggressive, make a decision alpha male look to the jawline, and that's what guys are looking for.
Yeah, that does look better. And finally, love handles.
Yeah, so
the age-old love handles.
The 50-year-old male breast and the love handle, very common. You can diet and exercise all you want. You can't focally lose it. So this is this is equivalent to our woman's outer thigh. Hard to lose that. And so love handle lipo, especially with SmartLipo, where a guy can do it under local, there's no risk of anesthetic death. And they can walk out, so you see a doc, you know, back to work on Monday, do it on a Friday.
because that looked really good. That before and after was just terrific. When you talk to them, obviously you have a chat with them before you do the procedures to find out exactly why they're doing it. Why are men doing it as opposed to women? I mean, I know women, you know, the panic sets in at about 40 and they're not looking as young as they used to, so they like to go, you know, get a little nip tuck.
I have seen over the last decade a real transformation. I think it's multifactorial. Number one, men are doing it because we're more subject to cultural perceptions of beauty and attractiveness.
Right.
Men are out of relationships and divorced in greater and greater numbers, and they tend to be dating and snacking in younger snack brackets, and they want to look fit to match their younger partners, and they're doing it for the boardroom. So the bedroom and the boardroom. In the boardroom, they've got all these young guys coming up with their MBAs, and they want to look definitive and authoritative. And if you're looking tired and saggy and droopy, that might translate into maybe the old man's losing it type of attitude, and they want to be strong, youthful presidents in the boardroom as well.
So, and going to the gym sometimes just doesn't crack it.
Yeah, sometimes it makes you worse. You lose a little weight, your skin tone falls, and then you look toned but saggy. You look like that old guy in Santa Monica or down at the lakeshore, walking with his shorts up to his chest. So. Okay,
just real quick, what should people be aware of if they're thinking about getting some sort of cosmetic surgery?
Make sure you do your homework. You know, the risks are real, and you want to make sure you have a real surgeon doing surgery. Make sure you've got a certified facility, and make sure that you've had some discussion with your physician on the nature of risk, because there is a risk, and anyone who's not talking about risk is trying to sell you a procedure, then educate you in a process.
Okay. Thanks so much for being here. It's always nice to see you.
Nice
I'll be talking to you after the show. You know what I mean?
Wow. What a great way to change your figure, shape, and form to capture what you really want to capture. We have gentle, minimally invasive ways to shrink your fat and tighten your skin. Ultrasound, SmartLipo, Body Tight. SpaMedica.com, check it out, look for the procedures, review it, see the before and afters, or come in and see me. I look forward to helping you get that figure, shape, and form you've been looking for.